Welcome to the office.
This is our final visit for this trip. We started a few days ago, and we came in for the multiple dislocated shoulders, and you were told immediately, let's go get some surgery, right? And what we worked on this week was, number one was the spine, the foundation, the scapula, and then you're going to go back and you're going to, about 2 weeks, you're going to start your rehab, and you're going to see how it goes. Right? And if you do need the surgery for any reason, at least we know the body is now prepared to receive it properly. Make sense? With everything we did, how is our mobility from day one?
It's a lot better, and I have more feeling in this area.
Okay, great. When did the feeling start to come back? Yesterday?
Today morning.
This morning? Okay. What else has changed?
I don't know, it just doesn't feel as weak. I feel like I can be out of my sling for a longer period of time without it just getting all sore and achy.
And part of what was going on is he's had 5 dislocations, shoulder dislocations. He did have surgery after the second one, second one. But the question is, why does it keep coming out? And the story and the take-home message here is, if we're having multiple dislocations, whether it's shoulder, I've seen patellas and ankles, then we have to ask ourselves why, okay? And that's really the take-home message. And it's not to say that surgery or no surgery. I don't want to go there right now, okay? We're going to see how the next 2 to 4 weeks go. And you have your practitioner there to evaluate it to see, does it actually need it? Maybe even take a follow-up MRI in 4 weeks, okay? Even 6 weeks. Okay. All right, and see kind of what's changed, because things have changed structurally. Any questions?
Not now.
All right, let's do the grand finale. Starting at the base of the neck. C6, C7. And yesterday we started to work on the scapula, and why did we do that? Because the scapula is the major stabilizer of the shoulder complex. So number one is get the power on. Number 2 is make sure just like foundation here, right? Everything is foundational based in this work. So for example, let's say we have 2 segments that are stuck or 2 segments that are bad. It doesn't make sense to adjust a bad joint over another bad joint, does it? So same idea with all the different joints in the body. Follow kinetic chain. So if we're following kinetic chain down the arm, we start with spine, scapula, humerus, and then work our way down, and then we rehab, right? That's kind of my philosophy. 5 points, C6. Upper cervical held after that adjustment, fantastic. T6 is also clear. And we found, we had our combo last visit, turn a little bit. We were working on the L5 and right pelvis. Let's see how L5 is doing. L5 is clear. We have right pelvis, we have C6, then we're going to work on the scapula and the ankle. That's 5. Tiny bit on that right side?
Yeah.
Tiny bit. Now, I'm going to check it after the hip adjustment because I'm getting nothing on the meter. Much better. Let's continue. Right hand up. Now, we said C6 was you okay with that on the shoulder? We're putting on the G-strap. C6 we said is a PRI. We're setting it as a PRI. Left ear down, down. Let's get a little bit more. Now if I'm doing an alternate move of C6 PRI, I'm not going to laterally flex too much to the right side because the wedge is on the left, and I'm actually pushing the spinous a little bit right to left. Look up. There's the rest. Nice. Walk it off once, sir. We'll go on the high low. And if you watch him walk, and we compare to first visit, do it one more time. We got less of that Texas wiggle. We got a little bit more up and down movement of the hips. Okay, let's go. We're doing the right pelvis. Go left side down. And part of what we went over in his case is he has a PI2 EX7, so it's more EX. And the idea is we want to get that right pelvis up because he has an 11 miller MD measure difference. We want to get that up as much as possible. And maybe on our follow-up, we'll do a spot shot of the pelvis and see kind of how we do. Okay? Are you okay on the shoulder today?
Yeah.
Yeah? Bring it forward a little bit. Okay? Relax it there, nice and easy. Doing it as a PIEX. It's more EX. So, there. It's already starting to go. Nice and easy there, PIEX. Like butter. Come up slowly, let's walk that off, please. And we're going to go face down over here on the high-low. And we're going to work on the left scapula. Left hand behind your back, please. Okay. And same thing like yesterday, we're going to motion it. When you put your hand there, is it a little easier for you? Is it hurting? I know it's tight.
Kind of like a little bit by the elbow.
Here, not up here.
Well, not really like that. Like a little bit up.
Here?
And inside a little bit more.
Here?
And up a little bit. Yeah, like over there.
Okay. So bring it down some. How's that?
Yeah, it's better.
Okay. So number one is patient relaxation. So we want to find that position. Now we're just going to be motioning. Is it okay if I do that?
Yeah.
Okay. And you're just breathing. And I'm just going lateral to medial. Good. 1, 2. We good? 3, 4, 5, 6, 7, 8, 9, 10. Good job. Bring it forward slowly. And I gotta check his ribs. 3, 4. Right there. Deep breath in, blow it out fast. There's the rest. Nose T4 rib. Can you humor me and bring that left hand behind your back again? Okay, good. Now bring it forward. And you're feeling that more here?
Yeah, kind of like in the back over here.
Okay, but not up here.
No.
Okay. Slide over towards me, please. I should show you guys one day the shoulder dislocation move that we do here. Okay. I'm just lifting, turning. Relax it down. I'm going to put your forearm between there. I'm just checking the biceps tendon. That's the tendon. I need to set the tendon in. I'm not touching the.
Okay.
Okay? I need to set the tendon. You gonna let me?
Yeah.
Okay. And all we're doing is we're gonna roll it over because it's out a little bit. Rolling it, rolling it, rolling it. Got it. That's it. Got it. Done. Done. Got it. So when the shoulder pops out, right, we have the bicipital groove and we have the biceps tendon. So anytime there's a shoulder misalignment, long-standing dislocation, we just have to make sure that thing seeds in. If it doesn't seed in, the shoulder won't stay. That's the final piece of the puzzle. And one of my mentors came up with that move, Dr. Mark Working. He's the one who came up with the biceps tendon lateral reduction move. Walk it off, please. All right, nice. Come back over here, have a seat. Let's do some machine work on the shoulder. You okay?
Yeah.
So his majors, C6, T6, L5, sacrum, right pelvis. Sacrum is all good. Okay, L5 may need a little bit of work later, not right now. And the pelvis, 6 is all good there. Stand up for me, please. Up, raise them up. And down. Raise them up this way. Okay, and down. When is it hurting?
Raising it?
Yeah.
Around like here is when it kind of
Where?
feels stretched.
Where?
over here.
Put it down. Raise it up again. Okay, and down. Now, turn and face the wall. Bring your right hand behind your back, please, as high as you can. Good. 1, 2, 3, 4, 5, 5.5 is where we were. Left side, please. Yeah.
Magic.
He was down here day one. 1, 2, 3, 4, 5, 6. So from T10, T11, we got that. And it didn't hurt too bad when you did that.
Nah.
Or did it?
It kind of hurt once again, just in this low area.
And you're feeling it more on the outside or deep in the bone?
The outside.
The outside. Have a seat, please. Raise your right leg. Raise your left leg. Stand up for me, please. We gotta set the elbow. I want you to hold your shoulder. Hold it right there, okay? And relax this part of the hand. Is that okay on your shoulder?
Yeah.
Ooh, gotcha. 5, 4, 3, 2, 1. Awesome. Okay, walk it off one last time, sir. And then have a seat, and let's just scope the neck, make sure everything is clear for you. All good, brother. You're all set. Questions?
Well, one, we have the track season that's upcoming.
Okay.
How long do you think it'll take for me to be able to come back?
Come back where? To track? Well, listen, anytime we're healing an injury, whether we fracture a bone, sprain an ankle, strain a muscle, healing principle, 90 days. It doesn't mean it hurts for 90 days, but it means 90 days to fully heal. If we go too early, what happens? We could develop compensations. Okay? Track is starting in how many weeks?
It already started
Okay.
a week or two ago.
I mean, if I don't see you going right now. I see at least 6 weeks, 8 weeks before you get into it. Okay, and you're going to start your rehab, your shoulder rehab, in about 2 weeks. Okay, in the meantime, it's just range of motion. You have access to a pool. Get in the pool and just get movement. You're not swimming. You're just moving and getting lots of motion in the shoulder. There's a video I have called Flossing for the Shoulders. I don't know that you'll be able to do it just yet, but in about 2 weeks you can start it. We'll send you the link for it. Okay?
Okay.
Give it some time. You're in what grade?
12.
Grade 12. So you're preparing for college right now. Let's focus on that right now, please. Okay? When it heals up, you go back stronger. Otherwise, you're compensating. And then we're going to play a game all over again. Okay? Fair enough? It was a pleasure.
Yeah.
All right, take care. And what was your friend's name again?
Jack Moses.
Jack Moses! All right, Jack, tell me what you thought about his case. All right, you take care. Safe travels back.
Thank you.
All right, Pops.
Thank you.
You're welcome.